Well, dementia cases are increasing as Australia's population ages. Experts say prevention is the key strategy to reduce dementia by focusing on whole brain health. Canadian clinical neuroscientist Professor Vladimir Hachinski joins me now. Professor, thank you for your time. Now, you're the 2024 Ryman Prize winner, which is a $250,000 grant awarded by New Zealand Prime Minister Christopher Luxon for the world's best discovery, development or achievement in this space. Firstly, congratulations. How do you feel receiving that award?
Well, wonderful. It also gives me a platform to talk about holistic brain health.
Yeah, incredible. I mean, stroke, heart disease, and
yeah, sorry,
I was
if I may,
bit of a delay there.
Yeah, if I may, I want to give you the bottom line and then give you the reasons for having the bottom line. I think the question I was asked is, how do you promote brain health? And I think the short answer is by promoting and practicing integral or holistic brain health, which is when you're thinking, you're feeling, and you're connecting with others is the best it can be. Now we're going to the details. Australia, and most of the countries of the world are facing a yogi problem. Now, I'm not talking about gurus or yoga practitioners. I'm talking about young, old, growing imbalance. In Australia, the life expectancy now is 84 years, and the birth rate is 1.8, which is short of the average 2.1 children per woman to keep the population stable. So a consequence of the aging population is that you have increasing dementia. Now, what are we doing about it? The bulk of the millions is going and discovering a drug that will stop progression from cognitive impairment to dementia. However, we have two of very marginal clinical effects and very serious side effects like bleeding to the brain, swelling of the brain, and also very costly. And the other problem with just relying on drugs is that even if we had a drug that stopped progression from cognitive impairment to dementia, you would not have any influence on the next year's people who get cognitive impairment. Because of the aging population, each year will be very different. So increasing numbers, of course, because of the aging population. So the only solution is what the World Health Organization advocates, which is brain health for the lifespan. Now, that's an immense job, so that it begins at conception. And the more you invest at the beginning, the more the payoffs at the end. People talk about brain capital. And this is going to be important not only to prevent dementia, but also to have better brains to prepare us for the digital age and also the knowledge-based society. So how do you implement it? People do not like to change. So we are proposing to begin with individuals who are undergoing change, people who are about to retire, new employees of hospitals in the first instance, and also expectant mothers and their partners. It's very important to have that in mind. And we're developing we're developing an ABC. Sorry? Yeah.
No, I was just going to ask there, Vladimir. I just wanted to talk to you about one of the points I want you to speak on is these modifiable risk factors, and doctors also have a key role in managing these. If you can just explain to our viewers, what are some of the factors? Where are we going wrong here where we can reduce the risk of dementia in later years?
Well, we know what the risk factors are, what should be done about it. The big problem is that they're unrealistic. You know, you're not going to change, you're not going to go to the gym and exercise, you're not going to change your diet from the diet you have to an expensive Mediterranean diet. So that's why we're developing an ABC of brain health, which is activity and sleep, a balanced diet and blood pressure control, and connecting with others, and make it so simple that most people can follow it. For example, the biggest benefit of activity is just moving. Just getting out and moving gives you some benefit. If you manage 3,000 steps a day, you decrease the risk of dying prematurely. And if you had 3,800 steps, you already decrease the risk of dementia. If you do it with someone else, you double the chances that you continue to do it. And if you do it in greenery, we decrease anxiety, blood pressure, and heart rate. And in fact, the Japanese show this to be effective, and they even have a word for it, Shurin-yoku, which means forest bathing. So to answer your question, we have to make it so simple. We have to address in the first instance people who are willing to change, and then we have to institutionalize it. In our case, it's the hospitals and a network of family physicians. And the big point here is we cannot leave everything to the doctors. We have to begin caring for ourselves. If we had a unique brain that had no replacement or repair, if it were a car, we would look after it very well. And we do not look after our brains as it was an expensive car.
Okay, so it's a holistic approach there. Vladimir, thank you for your time today and your insight. Again, congratulations on your award. We have run out of time, unfortunately, but thank you so much.
You're very welcome.